What is refractive surgery? Refractive surgery is an eye surgery that reduces dependency on visual aids such as spectacles and contact lenses. It is usually considered cosmetic surgery and is opted for better aesthetics by many. 1. PRK. PRK or photorefractive keratectomy is done under topical anesthesia or numbing eye drops. The outermost layer or the epithelium of the cornea is scraped off either manually or by using alcohol so that the laser applied has better penetration into the deeper layers of the cornea. Next, the excimer laser ablates the predetermined amount of corneal tissue depending on the refractive error of the patient. This simply means that the laser applied reshapes the cornea, making it either flat or steep. It is usually done in small refractive errors or when the patient is ineligible for LASIK due to lesser corneal thickness or irregular corneal surface. Trans-PRK is a single-step alternative to traditional PRK wherein instead of using any blade or alcohol, the epithelium is removed by the same excimer laser that is used to ablate the cornea. Therefore, the surgical time is reduced and the post-op recovery is also faster. The superficial layer of the cornea, when scraped off, exposes the nerve endings, which causes pain once the effect of numbing eye drops wears off. A bandage contact lens is placed to relieve this pain, but some amount of discomfort is expected. The outer layer grows back in around 3 days and this contact lens is then removed. Visual recovery also takes around 3 to 4 days. 2. LASIK. LASIK is the most commonly performed refractive surgery wherein instead of scraping off the outer layer, a flap is created in the cornea using a blade instrument or laser. The flap is retracted, and just like in PRK, the excimer laser is delivered to ablate corneal tissue. After the procedure, the flap is positioned back. Unlike PRK, LASIK is painless even post-procedure and the visual recovery is on the same day or within the next 24 hours. Creating the flap during the procedure cuts some corneal nerves, therefore the corneal sensations are reduced and dryness may ensue post-LASIK. 3. Customized wavefront guided LASIK. This groundbreaking technology is based on the fact that each cornea is unique, just like your fingerprints. The corneal surface is not smooth and these irregularities at microscopic levels affect the quality of vision. After measuring the irregularities, flap is created, just like in LASIK, and the laser is then applied to these imperfections to smoothen them out, resulting in an optically perfect corneal surface so that the patient can enjoy high-quality vision. Some patients have reported having better color perception and contrast sensitivity too. However, some amount of dryness is to be expected. 4. Relex Smile. Relex Smile is a flapless surgery, wherein the femtosecond laser creates a lenticule within the cornea, which is then extracted through a small incision. Hence the corneal tissue is not ablated, like in LASIK and PRK. Since it is a flapless surgery, there are fewer chances of reduced corneal sensation and dryness. But the visual recovery is usually later than LASIK because of some interface haze in the initial period of the procedure. 5. Phakic intraocular lens or implantable Collamer lens. Unlike other refractive surgery where the laser is used to reshape the cornea, in this procedure, an intraocular lens of calculated power is implanted behind the iris, and in front of the normal crystalline lens. This procedure can be done in patients who are not suitable for laser refractive procedures such as those who have thin corneas or who have high refractive power or who suffer from severe dryness. This is the only refractive procedure that is reversible because the intraocular lens can be extracted if necessary. After surgery, one might experience increased sensitivity to light, glare, and halos as one adjusts to the new lens. Vision may be slightly blurry but with time, it will start to stabilize. This usually takes around 2 weeks to months. Although rare, the intraocular lens can touch the natural lens and cause cataract, or it may touch the cornea and cause clouding of the cornea. It may even block the drainage angle and cause raised intraocular pressure, in which case, there will be pain and one should report to their doctor immediately. 6. Refractive Lens Exchange. In refractive lens exchange, as the name suggests, the natural, clear lens is extracted and replaced by the intraocular lens of calculated power, unlike in phakic intraocular lens, wherein the natural, clear lens is left untouched. This procedure is rarely done. There are many surgical options to get rid of glasses, and even though these refractive surgeries are usually safe and effective, they also have some associated risks, like any other surgery. It's best to discuss the pros and cons of each surgery with your doctor, to arrive at the right procedure for your eyes. Check out our channel for more eye-related content.